So now we turn to the health professional mobility and patient safety. So there is obviously a regulatory approach. This will be presented by David Hubert, who is the Healthcare Professionals Crossing Borders and EU Policy Consultant.
Hello, everyone. I'm trying to find the slides. Oh, there we go. Yes. Hello. So my name is David Hubert. I'm a policy advisor, and the reason I'm here is that I work a lot with healthcare regulators, and I've been doing so for the last 8 years, and that has given me, I think, a good understanding of what the issues that regulators have in this area of professional mobility, which Matthias presented so well. One of the things that I do in my role as an advisor is that I run the European network of regulators of nurses, and there are many other networks similar to that, and we all meet under an umbrella organization, umbrella network, which is called the Health Professionals Crossing Borders, and that unites all healthcare regulators in Europe to discuss about these issues. The whole legislative framework which underpins the movement of healthcare workers, which Matthias has spoken about, is ruled by the Qualifications Directive. It used to be called the Directive on the Mutual Recognition of Professional Qualifications. It's now been abbreviated to the Qualifications Directive. And the previous one, well, I will call it the previous one, was adopted in 2005. And it basically set out a number of rules on the recognition of qualifications obtained in another country. It really set out for regulators how they had to recognize and register health professionals that were trained and had practice in another European country. It did so, it had a lot of rules, but the underlying principle was, if you have minimum training requirements that every country observe, then we can decide that we will automatically recognize the qualification of each other's countries. When they did that, they also set out a number of common minimum training standards, and I have to underline that these are common minimum training standards. Countries can go beyond that if they wish. There is a really basic tension, because the Qualifications Directive is really about the movement of professionals in the single market. And that there's a tension there between facilitating the movement of professionals and also, on the other hand, protecting patients, patient safety. And that is really the mission of a lot of regulators, is to make sure that the professionals that they regulate are safe to practice, and they don't do any harm to patients. So we lived with the Qualifications Directive for a number of years, and as regulators we had a few big challenges that we really wanted to change. And I'm just going to highlight a couple of them here to give you a flavor of the things that we were confronted with. The first one was language testing. Did you realize that it was, well, it still is until January 18, 2016, it is illegal for regulators in one country to language test, blanket language test health professionals who come from another country. This sounds absurd, but it's the case. It's the case that the European Commission thinks that was seen as a barrier to the freedom of movement of healthcare professionals. So we found ourselves in situations where we had, as regulators, we had to register people who didn't speak a word of the language of the country, and that was a big issue for us, especially in terms of patient safety. The minimum training requirements were also an issue for us, because even though the directive here dates from 2005. A lot of the training requirements dated back from 1979, and they were really not suitable for modern ways of learning. They were really antiquated training requirements, and they weren't pertinent anymore. So that's something that we really wanted to change. We also had issues on the exchange of fitness to practice information between countries, because when a professional moves to another country, you would hope that the regulator in the host country would know the whole history of that person. I have a little story here that I use quite often. I was working with the nursing regulator in the United Kingdom, and we were speaking to our colleagues, the nursing regulator in Ireland, and we were talking about a recent case that Ireland had where they had to strike off a midwife. They're the regulators for nurses and midwives. They had to strike off a Polish midwife who had done harm, and she was found to be completely incompetent, and so they struck her off. And we were discussing this case with them, and then we thought, hold on, we recognize that name. So we had a look in our system, the UK system, and we realized that that Polish midwife had applied for registration in the United Kingdom. She had provided all her paperwork from her training in Poland, and said nothing about her time in Ireland. So that proves, I mean, that shows to you that there are some big issues there, that, you know, people can find loopholes to move. If they've been struck off, they could still find ways to go and practice in other European countries. And then another issue that we had, which I won't dwell on, it was continuous professional development. In some countries, it is mandatory for health professionals to do a certain number of CPD a year. In other countries, once you're registered, you're registered for life. So, you know, there are some imbalances there. So as regulators, we all came together and we lobbied for change. The Qualifications Directive was reviewed recently. It was adopted in 2013, and the transposition date for it is the 18th of January next year. So the new directive is coming into force in a few months, and we managed to have some wins there. Like there are a few things that, as regulator, we're much happier about. The first one is that we will now, for health professionals, we will now be able to ask for evidence of the knowledge of the local language. So we won't be able to blanket test, because that is still seen as a barrier to freedom of movement. But where we have doubts, we will be able to ask for evidence, and if we're not satisfied with that, we will be able to ask the person to sit a test, and maybe even refuse registration if they don't possess the necessary language skills. Another big thing that came that we didn't ask for as regulators is the European professional cards. The European Commission had seen evidence that some countries were putting barriers to their professionals moving out. We were talking about brain drain, and there had been instances where regulators made things difficult for professionals to move away. The European Commission is now introducing the European professional card as a way to speed up the recognition of qualifications. And in a way, that's really good for professionals, because, you know, it gives them assurance that they will be recognized faster. But for regulators, there's a problem there, because the deadlines are very short, and that sort of takes away a bit of the power that regulators have to control the training and the fitness to practice of incoming professionals. And then the third point is we are now going to have an alert mechanism. That's something that we're very happy that will be introduced. That will help us manage cases like the one I told you about, the Polish midwife. All healthcare regulators will now be on a network where we will have to share with other healthcare regulators across Europe alerts about healthcare professionals that have been struck off and that pose a danger to patient safety. So we really welcome that. We still, however, have some remaining patient safety concerns. The first one is the ongoing competences disparity between professionals in different countries. It's one thing to have a minimum training requirements. It's another thing knowing what the competences of the person is once they complete that training. And there is quite a variety of levels of competence across Europe. The second one is the variety in the scope of practice. So again, you can train people to do similar things, but in their professional practice, if they're not allowed to do some certain acts in one country, when they come to another country where the scope of practice is, let's say, much wider, these people could find themselves in a position where they have to practice out of their usual scope. So they will have to do things that they're not used to do. And then there's also an issue around the temporary and occasional provision of service. Matthias called it the Ryanair something. Yeah, we still have issues with that because in the new directive, we as regulators, there's a lot of the controls that are taken away from us, so we have less of a hold. We can't control as much as we'd like to for these type of people who move on an occasional basis. Quickly, ways forward. Well, as regulators, we realize that if we know each other, if we know how we work together, if we know the regulatory environment in each country, that means that we understand we can work best together to ensure patient safety. And one of the way we do that is, obviously, I talked about health professionals crossing borders. We work as networks. There's a European network for regulators of each each healthcare professions, and we meet on a regular basis, and we tackle a lot of the issues that I spoke of just now. I think that patient information is incredibly important because most patients don't know these things. Just to take the example of language testing, which will now be resolved, this is something that even employers didn't know about. So there's a lot there to be done to inform patients. And then one last point is I think that we need a more robust system to help accessing countries raise their standards of training of healthcare professionals before they actually join the EU. And it's been the case in the past accessions rounds that some of the countries that came weren't quite ready, hadn't been brought to the EU standards, and yet were given freedom of movement, freedom of establishment. And so I think in the future we will have to look at that and make sure that we don't let that happen again. This is the end of my presentation. You've got my email address there and my website. Thank you very much.